Hi, I'm Mark L. Miller.
And I'm Prentice Scudder.
We're here on behalf of Getinge. Today we're going to review the insertion steps of the Sensation Plus intra-aortic balloon catheter, as well as the initial setup of the CardioSave intra-aortic balloon pump. All right, Prentice, I'm going to walk you through the process here of preparing and inserting the Sensation Plus intra-aortic balloon catheter. Let's prepare the balloon catheter for insertion. When you open up the product box, you'll see that there are two trays included with the product. The first tray is the balloon tray, and the second tray is the insertion kit. So the first thing we're going to do is we're going to prepare the balloon by taking the 30 cc syringe with one-way valve attached. We're going to attach that to the extracorporeal tubing, and you're going to withdraw 30 cc's of air. When you do that, you're creating a negative prep. Now, if you would take off the syringe, leaving the one-way valve in place, that will help to maintain that negative prep, giving the balloon the lowest crossing profile to aid in insertion. Okay. So the next step, we're going to use a 10 cc syringe of saline flush. And what I'd like you to do is to flush the inner lumen of the Y connector with a minimum of 3 to 5 cc's of saline. Excellent. Now at this point, we're going to leave the balloon in the tray, and we're going to prepare for insertion of our sheath. Okay. So the great thing about the insertion kit is that Getinge provides everything in the insertion kit except for the lidocaine that you'll need to numb the patient's groin. So the first thing we'll talk about is the carrier. So if you want to take that carrier out of the tray, the carrier has an 8 French wire reinforced sheath, a dilator to be used for insertion of the sheath. It also comes with a stepped vessel dilator, as well as an 18 gauge angiographic access needle. In the kit, we have a 0.025 guide wire. Okay. This guide wire will be used both for insertion of the sheath as well as insertion of the balloon. We also have 2 pressure tubings. We have 1 3-way stopcock. We have 1 cap for the stopcock, as well as we have the extension tubing that is specific for the 50 cc Sensation Plus balloon that we're about to insert into the patient. So let's start out by taking the guide wire out of the tray. And at this point, if you'd like, I'll take the tray out of your field so you have more room to work. So just like you would any other wire, you want to give that a saline flush. Excellent. So today we're going to do a sheath insertion. So I'd like for you to take the 8 French sheath and the 8 French dilator out of the carrier. Insert the dilator into the sheath. All Getinge sheaths require a quarter turn to lock the dilator in place. Once you have that locked in place, you're going to want to flush that with a little bit of flush solution. Excellent. The last thing we need to do is we'll need to prepare that 18 gauge angiographic needle, and we're going to want to give that a flush as well. Excellent. Now we're ready to insert the sheath into the patient. Okay, Prentice, now I'm going to need your help to establish access and place the 8 French sheath. So I've already numbed up the groin with lidocaine. So I'm going to use the 18 gauge radiographic access needle. Using my fingers, I'm going to find the femoral pulse Once I find the femoral pulse, I'm going to insert the access needle into the patient's femoral artery at a 45-degree angle or less. Inserting the needle at a 45-degree angle or less will provide a shallow angle of insertion, which will help to prevent the kinking of the catheter. Once I have blood return, I need to insert the 0.25 guide wire. My wire is floating freely. Okay. Once I have the wire in place, holding pressure, I'm going to remove the needle from the guide wire. If you could hand me gauze. I'm going to wipe the wire with a wet, lint-free sponge. And now we're going to need to put the sheath onto the wire. Now with a slight rotary motion, I'm going to insert the sheath into the patient. Once I've got the sheath into the patient, I'll use a quarter turn to unlock the dilator from the sheath, and I will remove the dilator from the sheath, leaving the guide wire in place. Okay, Prentice, let's now insert the balloon catheter into the patient. So first thing I'd like you to do is take off the blue protective guard. You'll see step number 2 is to take the balloon catheter, take everything out of the tray in one piece, lift everything straight out. And I'll remove the tray. Okay, now we're going to need to pull the balloon catheter out of the blue protective T-handle. It's very important to pull that T-handle off of the balloon straight, making sure that we do not bend the balloon catheter as it comes out. At this point, we are safe to touch the radio-opaque tip of the balloon. We want to make sure that we do not wipe the balloon. We do not dip the balloon. Any of those actions could potentially unfurl the balloon, which would make insertion more difficult. So now I'm going to insert the wire into the balloon catheter. And if you could, just let me know when I have wire Okay, so hold the wire nice and steady for me. And I'm going to now insert the balloon catheter into the sheath. It's important to note that when you insert the balloon catheter into the sheath and you depress the hemostatic valve, you could get some blood coming back and potentially even channeling along the folds of the balloon. That's normal. There's no problem there. Very important, now I can touch the balloon catheter. Prentice, it's very important that you insert the balloon catheter in little 1-inch strokes or 2.5 centimeters. As we insert the balloon into the sheath, grabbing it 1 inch will prevent the catheter from potentially kinking. Okay, now that I've got the balloon into the descending aorta, I want to confirm placement. If I have fluoroscopy available, I want to confirm placement that that radio-opaque tip sits approximately 2 centimeters distal to the left subclavian artery. Visually, that's in about the 2nd to 3rd intercostal space. Once I've done that, I'm going to slide the stack guard sheath. I'm going to slide the nose cone into the sheath. The catheter that's now inside the stack guard sleeve, this will help to maintain the sterility in the event that we need to advance or pull any of the catheter out of the patient. At this point now, we can take the wire out of the balloon catheter. Okay, Prentice, now that we've inserted our balloon catheter, we're going to need to attach it to our balloon pump to start therapy. The first thing I'm going to do is I'm going to hand to you a 4-foot piece of pressure tubing. So if you could just connect the female end of the pressure tubing and now if you could flush through there for me, please.
If we have a fiber optic, why do we need the flush?
Well, Prentice, we want to make sure that we maintain a minimum of 3 cc's per hour through the inner lumen. That's going to help to maintain patency and prevent any thrombus from accumulating on the tip of the catheter. So once I've attached it to the inner lumen, the 3-way stopcock, I'm going to need to turn my stopcock so that I can aspirate. I'm going to start by aspirating 3 to 5 cc's of blood. So now I have a nice blood return. I'm going to discard that blood, and I'm going to use a saline flush, and I'm going to slowly infuse 3 to 5 cc's of flush. Okay. The next thing we need to do is we need to attach the fiber optic cable to the balloon. So I'm going to hand to you the fiber optic connection. If you can take off that dust cover, and if you look, there's a red arrow on top. There's a red arrow on the machine. So if you could line up the 2 red arrows, slide down, and insert that in until it clicks. Excellent. The last thing we need to do is I need to take the extension tubing. I need to hand the male lower end to you. Now it's safe to take the 1-way valve off of the extracorporeal tubing, and I'm going to attach that. And now if you can insert the male end of the extension tubing into the patient interface module. All right, Prentice, now that we're all hooked up, we're going to need to press the start button to initiate therapy. The green button in the upper right-hand corner of the touchscreen, if you could press that for me, please. Excellent. It will take a few seconds now for the balloon pump to autofill and calibrate the fiber optic sensor. This is a great time to point out that at all times the CardioSave should be plugged into AC power. Okay, Prentice, now that we started therapy, there's a few things we need to do before we prepare the patient for transport. The first thing we need to do is we need to secure the balloon catheter to the patient's leg. So let's start out by taking the alcohol swab and swabbing the skin near the suture pads. Okay, now we're going to allow that to dry. So let's take our stat lock and securing the suture pads closest to the insertion site, we're going to lift up the suture pads, snap them into the retainer, close the locking retainer lids until they snap. Very good. Now you can remove the backing, which will expose the adhesive bandage, and apply that to the skin. It's very important to do the one closest to the insertion site first. Very good. Now do the same thing for the rear suture pad.
Oh, there we go.
There we go, very good. Lock that in place. Nice job.
Thank you.
Okay, Prentice, the last thing we need to do before we prepare the patient for transport is to attach the orange fiber optic cable to the extension tubing using those blue clips. Those blue clips serve three major purposes. The first one is cable grooming. The second one is protecting the fiber optic cable. And third, to keep the cable from possibly becoming entangled and moving the balloon catheter out of proper placement. I think the last thing I'd like to let you know is that if you do have any emergency support needs, on every balloon pump, you can see we have a 1-800 number that you can call 24 hours a day, 7 days a week to speak to our emergency helpline. Okay, Prentice, that concludes your in-service for today. Thank you very much for attending and good luck.
Thanks.